All right, good morning. In the times of COVID-19, we all probably know at least one mother who is pregnant right now or expecting, and these are tough times for someone like them.
This is Good Morning Bangalore with Kay. 94.3.
Now, if you're just about tuning in, my name is Kay. The show is called Good Morning Bangalore. Now, I've always wondered what sort of plight, say, a pregnant mother would face in a crazy time like this because, of course, home quarantine. A lot of reports come in from across India where a lot of pregnant mothers have been refused treatment. There have been issues in nursing homes as well because these are just weird, insane times that we are living in. And it's understandable. But to deny care for mothers out there is horrible. So if you're a pregnant mother listening and if you know of someone who is going to face a certain predicament, I think we should get into the nitty-gritties of talking about how you can aid them and how you can support them. I'm going to bring out somebody lovely in just a bit. Dr. Mahima Bakshi, who is the author of Birthing Naturally, and also she's very much into a YouTube show that focuses on mental health, child and mother care as well. More than anything else, she's been on the show in the past and I've enjoyed my conversation with her, so I have to bring her back. We'll chat with her on the other side a little bit more. Dr. Mahima Bakshi joining me all the way from Delhi. Back in a bit. Stay tuned. Joining me all the way from Delhi this morning, Dr. Mahima Bakshi, who's the author of Birthing Naturally and does a lot of work with mothers and children out there. Good morning.
Hi, good morning. How are you?
It's so lovely to hear from you again. I hope you're doing well.
Doing well, and yet waiting for things to get back to old normal and not the new normal.
I think you and me both.
This is Good Morning Bangalore with Kay. 94.3.
Dr. Mahima Bakshi's been on the phone lines with me in the past. We've talked about her book, which is Birthing Naturally. We've also spoken about the things that a lot of mothers and children out there face in normal times. But I thought it would be great to get you on to speak about COVID-19 times. I was just telling everybody before the break how a lot of mothers have been denied care when they go to hospitals because of the risks involved and things like that. Have you faced anything on a first-hand basis? What do you have to say about the current predicament we're in for pregnant mothers and, young children out there?
So yes, a lot of cities we've seen the news of pregnant women being refused to, get admission for delivery. They're not being treated on time. The scans are not being done on time. And a lot of miscarriages have also happened due to this reason.
Sure.
So it's very sad that in such times, pregnant women and children are the ones who always get affected the most. And currently, we all need to get together to help them during the pregnancy phase, during the lactation phase, where these moms need extra support from their family and from the community.
The funny thing, it's not, urban areas, we are a tad bit better off. But like we were just talking before we started this conversation, you and I were talking about rural areas and the crazy things that they would face. That is immense, right?
So if you also see all the migrant workers who are traveling, they're walking by road. A lot of them are pregnant and they have to walk so many kilometers in the scorching heat. So imagine what they are going through in the pregnancy state, or small little children who are, accompanying their parents and trying to go by road, walking. And it's terribly hot in Delhi, and all these places where these children and mothers are traveling on, by walking. It's just so sad to see them, and we feel so helpless that we need to do something for them, and yet we can't understand what exactly to do.
Right. So what can we do? We'll come back with Dr. Mahima Bakshi on the other side. She's the author of Birthing Naturally, and she's a person who does a lot of work with mothers and children out there. She's actually, as I speak to her, on the road right now in Delhi, on the way to a hospital for work. Work doesn't stop for you, does it?
No, it never does.
All right. We'll be back with us super soon. Stay tuned. All right. I am back in conversation with Dr. Mahima Bakshi. She's joining me all the way from Delhi. Good morning. How are you? I hope that through your busy schedule, you managed to get in a meal at least.
Yeah. I make sure I do that.
Super.
This is Good Morning Bangalore with Kay. 94.3.
For mothers out there, especially in home quarantine, I can only imagine it's tough. I have a friend who's pregnant right now. She's due anytime in June. And we've been talking in depth about the things that she will kind of face and things like that. But also we've been focusing on how she's just hungry all the time. And more so because, she's at home. She's kind of, being pampered by her mother and things like that. Your tips, Dr. Mahima, for people out there in home quarantine, particularly how to deal with home quarantine better, especially if you're a pregnant mother.
So I've made this, easy tip for pregnant moms to remember. I'm advising all the pregnant moms to follow pinch protection. So this pinch protection is basically something that I have come up with. In pinch, first P is for positivity. So very important for moms to take care of their mental health. So they must think positive and stay calm, do meditation.
Definitely.
Then I is for immunity. So they can build up their immunity by doing some prenatal yoga at home. Then N is for nutrition. They need to make sure that they're eating right, because they're at home, they would probably constantly think about food. It's better to have homemade fresh food with lots of protein, vitamins, and all the healthy food items. Then, because it's very hot, they must maintain their hydration levels. Being at home, they might not feel very thirsty, but they need to make sure that they're having enough hydration. C is for continuous compassion and care from the family, from the husband. So everybody in the house should make sure that they're giving a constant affection and care to the pregnant lady.
And also that she's comfortable.
Yes, and she must feel comfortable. And H is for hygiene. So not just her, but everybody around her in the house also must maintain good hygiene for her safety. So this pinch protection is easy for people to remember.
I love it. This is something so nice. I never thought in my beginning of, I don't know, pinch me, this doesn't sound real. Awesome. Okay, great. When we come back on the other side, let's say some mothers out there going into delivery in, like my friend, like I just told you about, in the coming month or so. Let's talk about the precautions that they should take specifically when moving towards hospitals and things like that. I'm back with Dr. Mahima Bakshi on the other side. Stay tuned. My last leg of conversation with Dr. Mahima Bakshi, who is chatting up with me all the way from Delhi. She's the author of Birthing Naturally. She's a person who advocates, the care that mothers need and the care that young kids out there need. Thanks for joining me. I hope you're well.
Thank you. I've always been looking forward to talking to you on Radio 1.
This is Good Morning Bangalore with Kay. 94.3.
Now, we focused on all the things they should be doing in home quarantine in COVID-19. You spoke about the mental health angle, which I loved personally. And it's so important because it also marks how May is a mental health awareness month. Let's move to, say, for example, a mother has to go into delivery. What does she kind of need to keep in mind? And what do the family members have to keep in mind?
She must be well prepared for her delivery in COVID times. So most importantly is for her to decide where is she going to deliver, whether the hospital has a separate entry for pregnant women going for labor, or it's a common entry for all kind of patients. Then how many COVID patients are there in that hospital? Is the floor isolated from the rest of the patients? And what are the new SOPs that the hospital has made for labor room? Because there are new SOPs being followed in hospitals for labor delivery. So how many people are allowed inside? Is the partner allowed or not? Then post-delivery, how many attendants are allowed? So it's very important for her to understand and be mentally prepared in terms of what all is going to happen in the hospital and where she's going to deliver.
And more than anything else, like you said, a little bit of kindness and consideration when people see pregnant mothers out there moving around in COVID-19 times never hurts anyone. Am I right?
Yes, so that's one of the reasons. So I have come up with this online initiative of helping pregnant women in quarantine. So I've started this complimentary virtual group support system for them. So that's
beautiful.
Free.
Where can everyone find that?
So there are details on my website, which is mahimabakshi.com. And it's perfectly free of cost, and it's just an effort and initiative to help pregnant women during quarantine.
I want to say thanks so much for chatting up. This has been so cool talking to you. And, next time we should stop doing this over the phone. I need to see you in person in the studios, okay?
Sure.
Thanks, Dr. Mahima. You have a lovely day. Take care.
Thank you so much, Kay.